this evening, I want to speak with you about first aid in non-traditional companion animals, like exotic animals or whatever you want to call them, and what we can do or we should do before going to the vet. First of all, I don't want to disappoint anyone, and this event is literally quite broad. Means that we'll take in consideration any possible non-conventional animals, so from the rabbits to tortoise to pavlovs. It's an informative event, so it's not an official training qualification. You won't be after this event an exotic rescuer, but will be probably more aware and more confident with the more basic things that you can do to help your friends. And because there are so many species, I won't be able to speak about everything and all the conditions. So what I selected here are just the most common situation that you can face with your animal and the easier one that you can manage still at home. For anything that won't be discussed here this evening, and for anything that require not just first aid, but for proper emergency, you need to refer straight away to your vet. And also remember that every patient is different, and this is just a glance of the possibilities. Means that, oh yeah, I saw that my friend has this rabbit, my friend doesn't count, because every situation could be different one to the other. And there are no silly questions, so please pop up your message, your question in the chat box, and depending on the availability of the time that we have at the end of the event, I will try to go through more, hopefully all, but at least most of them. And I forgot to mention that at the end, there will be on the last slide, a QR code that you can, with your phone, take a picture, and we'll open a page with a survey. This survey will be very helpful for me to know how the event went, if you like it or not. And I put also the chance for you to put any interesting topic that you want in case in the future that will be treated on this kind of event. And just for people that are possibly sensitive to blood or wounds, just bear in mind that there are few pictures that contain like wounds, so explicit content, but nothing to be very scared. But if you want, I can try to remind you when this will start to appear or when we are speaking about these things. So let me see if there is anything else that needs to be admitted. No. Let me just change this. Okay, perfect. So who I am. I'm Gianluca. Nice to meet you, all of you. And I know most of them because I recognized you, but for all the other people that don't know me, I'm from Italy, and I graduated in Italy, and 6 years ago I started and moved here to the UK. I have been based in the south for 6 years, and now I moved to the very north in Scotland, to Edinburgh, and I'm lecturer at the University of Edinburgh, and speaking about rabbits, exotics, and wildlife. So say that I like to speak about animals, and every time that I have the chance to report a case or try to share my experience, I like to participate to conference events or organize events like this to share also to other people, owners, and people that potentially can take some insight and help from what I'm going to tell you. So, first of all, try to classify the patient. So we have patients that can be considered in the class of the routine patient, means all the patient that can wait, like for example, for a routine health check, for a vaccination, for a pre or post hibernation check, or pre-post ops check. Immediately after, we have the patients that are stable. Means that are patients that need to be seen anyway, ASP, in the next 24, 48 hours. And then we have the proper critical emergency patient that need to be seen as soon as possible. And first of all, what is an emergency? The definition of emergency is quite subjective, I think, because everyone can obviously interpret the term emergency in their proper way, depending on the bonds that you have with your animal and with the experience that you have facing with the situation that you can have with your animal. Means that a bleeding for someone could be, oh my God, a bleeding, a problem, he's dying, or, oh no, it's just a bleeding, no worries. So, but to give a more objective definition, an emergency is a serious and unexpected situation involving illness or injuries and require immediate action. Okay. Means that, therefore, knowing how to behave in this type of situation could be very helpful if it's not vital. Because if we know, we are probably, we can manage this situation much, much better, and at least without panicking too much. And most of the time, this situation happen unexpectedly, so we cannot have our first aid kit always with us. In the meantime, obviously, when an emergency happens, what we can do. And here is where the first aid is stepping in, because this is literally the first step towards the treatment and not always the end. Means that is try to start to help our animal to obviously make him in the best situation and in best condition to be brought to the vet and have the rest of the assistance and the what he needs. So the first aid is something that is a procedure or a group of procedures that tend to preserve life, to provide comfort. Think, for example, a rabbit that is rolling. You can put in a carrier with some towels all around to avoid that his situation can deteriorate more. Prevent suffering. For example, if there is a parrot with a broken leg, yes, you need to go straight to the vet, but you can also try to, without cause any more damages, try to or cover the wounds or try to stabilize and avoid that the parrot can move his leg, because this can cause much more pain and discomfort. Here there are some tips on how you can provide first aid and deal with the trip to the vet. So back to our classification. Essentially this evening, we are not going to speak with what is considered routine, but we are going to speak about what is stable or critical. So which are the stable conditions that we can, how I say it, deal without not rushing straight away to the vet? For example, in small mammals, rabbits, guinea pigs, rats, hamsters, there are few conditions like a tilt. Most of you, I think, if I say the word E. coli, they already know what I'm speaking about. And in few cases, the main sign of this disease is the head tilt. So when the head is twisted in a different severe degrees, but when this condition is present like a chronic problem, is, yes, need to be seen as soon as possible, but has been like this for the last few weeks, months. Your rabbit already received the first attention, test, treatment. But if you need obviously to be reseen because it looks like that is getting worse, absolutely. Is still eating, is pooping fine, great function are still maintained. So if there isn't obviously the chances to let him see as soon as possible is something that possibly can wait. But again, you know your rabbit and the clinical history of your rabbit. So take this like usually it's like this, but oh yeah, but my rabbit, I know that my rabbit is not like this, probably need to be seen sooner. Then we have cloudy urine. In rabbits, guinea pigs, is quite frequent to see them produce urine that are more cloudy, white, or also sometimes also more red. Okay, but most of you know that this type of urine are most of the time related with the diet, but are something normal. If to the cloudy urine, that is, again, is not a proper emergency, you can see also that your animal is struggling to urinate. In this case, then it starts to be a proper emergency, because it means that there is something else that is causing him pain, discomfort. And the other thing could be scratching. When a rabbit is scratching, a rat is scratching, sometimes is because it's just an itch, so nothing to be concerned, or because there are some skin parasites that you can try. You cannot see most of them, but sometimes it's possible. The situation is completely different if he's scratching so much because the itch is so stressful for them that he start to scratch and start to cause some damages on the skin, some open wounds. In this case, obviously needs to be seen as soon as possible. Reptiles. Also in this case, we have the stargazing, that is a sort of same a tilt for the small mammals. What means is literally looking the stars, because there is this twisting of the head. Also in this case, if it's a chronic problem, can wait. If it's something that happened recently or quite suddenly, this change completely the situation. Your bearded dragon is more rounded or is not producing eggs. Also in this case, is something that, yes, for sure, is something that needs to be seen as soon as possible. But again, it's not a proper emergency. But it's something that you need to, anyway, grab the phone and ask some advice to your vet. Birds, quite commonly, they can develop a swollen crop. Again, it's something that you shouldn't leave there and, oh yes, I see that it's more swollen, I will see tomorrow. No, you can try to feel it. You can see if there are any unusual behavior that your bird starts to show you. Anything that, oh yes, usually is eating quite a lot, now is not. And again, it's something that should be seen in the next 24, 48 hours. So as soon as possible, don't leave the crop swollen for, sometimes I saw, also in chicken, it's happened quite frequently, that has been left for weeks. Don't do that, because then you can, the situation can become worse. You can also some other problems like weight loss because the bird is not eating. So again, feel the crop, not normal, perfect. Try to book the appointment with your vet as soon as possible. And also the regurgitation vomit signs, if related with a behavioral problem, they are not urgent. Differently, if your bird looks like that's like also like seizuring or is literally not eating at all. So how you can see in this case, there is some nuances that can literally change a situation that we can define stable to a proper emergency. And then we have say these are more specific. All the other group of situations that can be crossover the different species are like a bleeding claw. Oh yes, I was clipping the nails of my rabbit and start to bleed a lot. So when you're, for example, cutting the nails of a rabbit, what could happen is you start to bleed a lot. Looks like that is never-ending bleed. I assume that many of you face this situation. And what you need to do, most of the time is enough. Take a tissue. You can just make a compression for a few minutes and stop. Don't try to. Sometimes there are at the vet practice. What we have are like caustic pen that we use to cauterize these small bleedings. Is something that you can have, but again, most of the time, some firm compression for a few minutes can stop the bleeding. If you see that it's still bleeding also after these few minutes, after this probably should push you to give a ring to the vet and say if they have any other advice. A wound you can deal with a scratch, a superficial scratch, okay, because the rats, sometimes they can play a little bit rough, or ferrets. Ferrets is quite, it's normal that they are quite rough when they're playing. And if there is a scratch or a very superficial wound, you can, again, what you can do with a wound that happened to yourself. So you can clean or with a wipe and wipe the wound with some clean water and then see if it's still bleeding, perfect, go to the vet. If not, again, don't apply any plasters, any cream or anything else. And also to clean the wounds, if you are concerned that the infection can become infected, try to don't use any like hydrogen peroxide, because it could be very painful. Think if you put hydrogen peroxide on your skin or your wound, start to burn quite a lot. So it's not a nice experience for your animal. And so if you have like iodine, very diluted, or some of you probably have other disinfectant. But again, most of the time, if you're anyway going to ask for more help to your vet, some water is already enough to clean the wound. Again, other situation quite common, eating less. I mean, I cannot ask to all of you to raise your hands, but I assume that most of you will do that. If I say, how many times suddenly your rabbits or your guinea pig stop to eat for a few hours and you start to panic? I think all of you. So if this happened for just a few hours, because sometimes they can also, we know that the rabbit need to eat every time, but sometimes they can also take a break and then restart. So panicking is a normal reaction, especially obviously with this type of animals that like to make us worrying more than necessary sometimes. And you can try to see if the rest of his behavior, their behavior is normal. Oh yeah, I can still see the feces that are normal. He's going anywhere around, he's hopping around. If I try to stroke, he's doing anything that is unusual for them. You can try to feel the belly. Okay, so you can try to see if he's soft, comfortable, doesn't cause any strange reaction or anything that you can relate with pain, discomfort. Oh yeah, probably is anything that to be very concerned. Different if you feel the belly that is very, very, very tense, or you can feel that obviously the rabbit or guinea pig is flinching, means that, oh yeah, is in pain, discomfort. Weeping eye. Also, this is another condition quite common in rabbits, guinea pigs. Sometimes we can have the same thing also in parrots, chicken, or on a tortoise. On all of them could be a different reason. The first thing that you can try to do anyway is try to clean and wipe the eye around to avoid that they can develop any further problems or start to be more itchy, the skin surrounding the eye. Then they can start to clean more, and just for grooming themselves, they can make the situation worse. Diarrhea. Diarrhea sometimes can be related with parasites. Think, for example, in reptiles or birds. Sometimes could be related with the diet. The rabbit ate something that shouldn't. There has been a change in the gastrointestinal flora, and this causes this microbiome, means literally when the normal bacteria that are in the gut has been traumatized, stressed by a food that wasn't the proper one. Again, if it's just, and what could also happen frequently is confuse a cecotroph, so the feces in the rabbit that are tiny, translucent, a little bit wet, and cluttered all together with a proper diarrhea. So if it's a cecotroph and it's just one, you shouldn't be very concerned, but you just start to keep an eye on your rabbit and see, oh no, it's just one because probably has been distracted when he was going to eat, because usually they are eating it fresh. So when they are literally producing this cecotroph, they are going to eat it. If at that time they has been distracted by an open door, or I don't know, a barking dog outside the house or anything else, they can just leave there and they're not going back most of the time to eat it. If you see more cecotroph in during the day, this is another situation where you should inquire your vet and say, sorry, but it's normal. Can I bring him tomorrow to have a check? Or you can bring a sample to the vet to have a proper check on the feces, just in case there is anything that is not right. Also, smaller feces is the opposite. So when the cecotroph usually, or the diarrhea, is when they're producing too much feces, small mammals, most of the time, so herbivores mainly, they can also have the opposite condition, that they start to produce smaller feces. I had once a very nice client in Italy that when I asked her to, please, can you monitor the feces production of your rabbit? Because there was some concern about how much he was eating and if he had any other problems. And she literally started to count and put one close to each other, the feces, and send me a picture to show me how the feces were going smaller. And then another picture like the day after when the feces start to growing back to the normal size. So this could be very helpful, but don't worry, it's not, you literally don't need to count every single poo. Or when you have a rabbit, you have the eye. It's like the sixth sense to see, oh yeah, I can see that they are smaller, or yeah, I can see that there is something that is not right. And to end the stable list, there is a couple of sneezing. Oh, my rabbit is sneezing a lot, or my parrot is sneezing. Sometimes also tortoise can sneeze. And again, if it's something that happened just once, especially, for example, if the rabbit went under the sofa because, oh yeah, I didn't have time to hoover under the sofa and there is a little bit of dust, could be a normal reaction. Or, oh yes, I just changed the type of hay and looks like that with this one is a little bit more dusty and it's sneezing much more. The same situation can happen, for example, with tortoise, that sometimes they tend to put the head under the soil if they try to dig in the leaf or in the garden, or the parrots when he's trying to destroy something and is producing some dust or anything else that can cause an irritation of the airways. In all this situation, if it's just a sneeze, it's not like 10 sneeze in 5 minutes and then again 10 sneeze in another 5 minutes, and there is any discharge or, again, any unusual behavior, is something that you should monitor, because you need to know, oh yeah, no, today has been one sneeze, fine. Oh yeah, no, but the day after, oh yeah, but today is sneezing much more. So, see, these are all information that also you can report to your vet, because your vet will be pleased to know, oh no, it's something that happened just sometimes, or no, start to be more frequently, happen more often than usual. And this can help him to decide also what to do with your animal. Oh yeah, no, probably we need to investigate the airways or with an X-ray to find out if there are any involvement of the deepest airways, or we need to investigate the first airways because probably there is something in the nasal cavity, in the nostril, and in this case change completely, because it can possibly offer you an endoscopy or a CT scan. So see, few little things can literally be massively helpful for what can be done after. And But again, in all these situations, you still need to call your vet, because they can become an emergency if they are ignored. As I say, with the swollen crop, if I leave there for days, at some point he will be so hard, so big, and that the bird was already not eating for a few days, that the situation can drastically change from something that could be fixed quite easily, possibly, hopefully, to something that instead required a more invasive or more urgent intervention.